Hey y'all, I'm Brian Miller, one of your Associate System Medical Directors. In this Performance Improvement module, I'd like to provide an update on some upcoming equipment additions aimed at enhancing our ability to provide better care for premature infants. Premature infant care came onto our radar last November when a few of us attended Dr. Heidi Abraham's lecture on micropreemies at the Texas EMS conference in Austin. Dr. Abraham is the Chief Deputy Medical Director for Austin-Travis County EMS and an absolutely phenomenal educator. We decided to work with her to film her talk so we could share it with y'all as a voluntary continuing education module. I would highly recommend you take some time at some point to watch this incredibly educational video. During the development of her video though, we identified two essential items that we needed to add to your equipment list. First, we will be introducing smaller face masks for the bag valve mask. Effective ventilation, as we know, is crucial in any neonatal resuscitation, and our standard infant masks are often too large to create an adequate seal and effectively ventilate premature infants between 20 and those early 30 weeks of gestation. These new preemie or size 0 masks should be used in conjunction with the infant size BVM. However, it's important to note that the tidal volumes for these premature infants are very small, typically 5 to 10 mLs or just enough to achieve chest rise and fall, as some of these infants are going to have weights less than 1 kilogram. Second, we will be providing transport mattress warmers. Infants of all gestational ages, and especially preemie infants, are susceptible to rapid heat loss. Studies have shown that there can be upwards of a 3.5 to 5.5 degree Fahrenheit drop in temperature within the first 30 minutes of a neonatal resuscitation. Hypothermia poses a significant risk of mortality and morbidity for infants and is a focus of neonatal quality improvement efforts across the nation. In low birth weight infants, multiple studies have demonstrated that every 1.8 degree Fahrenheit drop below 96.8, the mortality rate dramatically increases upwards of 28%. In the pre-hospital setting, the deck is totally stacked against us. We're exposed to all those external elements and lack the advanced incubators or warming resuscitation tables found in hospitals and labor and delivery units. This makes temperature regulation much more challenging in the pre-hospital setting. To address this, we are introducing these transport mattress warmers. These function similar to hot hands, hot packs, or those hand warmers, but are actually infant-sized. What you're going to do is you're going to activate the warmer by grasping the metallic disc between your thumb and index finger and bend it back and forth until crystals form around it. Then we're going to gently knead and move around the gel for around 10 to 30 seconds to actually distribute the heat in the pack. Then you're going to create a small indentation or nest for the infant in the gel with your hands, and then place the infant on the fabric side, not the clear gel side of the mattress. In addition to using these warmers, it's essential to minimize exposure. We're going to do all the same things we usually do. We're going to increase the temperature in the ambulance and bundle the infant with blankets. For preemies, you can also consider wrapping them in a plastic wrap or in a plastic bag. And of course, ensure that the face and the mouth still remain exposed. But this is enabling a greenhouse effect that promotes additional warmth and is safe to use in conjunction with the warmers. More detailed information on warming techniques will be provided in the upcoming video by Dr. Abraham as well. It's important to note that these warmers can also be used for term infants if additional warming is required, especially in those cold environments during the winter. In summary, these new additions, the smaller face masks and the transport mattress warmers, are designed to enhance our ability to provide the optimal care for premature infants during resuscitation and transport. While we hope you never encounter such situations, these tools will better equip you to deliver the best possible care should you encounter these very vulnerable patients. That wraps up these changes, so until next time, take care and be safe, everyone.